One of our other top stories this morning, URI got the attention of one of the country's leading doctors on coronavirus, Dr. Deborah Birx, visiting the campus yesterday.
This is actually the 23rd university she has visited lately to talk about ways to stop the spread of the virus among young people. And 12 News reporter Kate Walsh is joining us now with why URI says it's considering a curfew for students.
Well, Dr. Birx's visit came just a day after URI reported 30 more positive cases Wednesday, bringing the total on campus this semester to 100. But that could be due to the fact the university is testing the entire student population right now. They're wondering how many students may test positive but are asymptomatic. So Dr. Birx said her concern on all campuses is the spread among small groups of people, the types we see when people live together, especially students, and those who are positive but don't even know they have it. That's why URI is in the process of testing all 16,000 students on campus. The institution's president said they're averaging about 1,600 tests a day for 10 days. He said as of right now, there is no curfew for students, but it is something they're considering. It may be a way of managing the spread of the virus, he said, if they find through this mandatory testing that there are a significant number of asymptomatic cases coming back.
The decision point on whether we impose a curfew or not will simply be what are best, in part based on the outcomes of the asymptomatic spread testing that we're now doing, our analysis of just what the threats might be to our campus community and to our off-campus student community as well.
Now, we're also looking at how other colleges are faring right now. Providence College has cleared some students to return to in-person learning after they had a recent outbreak of the virus. Those who were tested between Sunday and Tuesday could start up again yesterday. Others who were tested on Wednesday can return today, we're told. Students are required to go through a re-entry process before they're able to return to campus. In the next half hour, you'll hear Dr. Birx's outlook for the spread of the virus in New England this fall. You'll find it very interesting. I'm Kate Walsh, 12 News.
One of the nation's leading doctors on the coronavirus task force commending Rhode Island for testing efforts.
So Dr. Deborah Birx visited with Governor Raimondo and also the health department officials Thursday at the University of Rhode Island. She then spoke to the media about those conversations.
12 News reporter Kate Walsh joins us now live with what the doctor's outlook is on the virus here this fall.
Guys, the outlook is pretty interesting. Dr. Birx first applauded Rhode Island for having tested more of its population than any other state. While at URI, she also heard from campus researchers working on a new way to test for the virus. She said they're using different reagents to make the test more applicable in places around the world. Testing, she said, is key to stopping the spread of coronavirus due to the many asymptomatic cases they're seeing out there, especially among college students. Dr. Birx also gave an outlook for the fall in the Northeast after we're starting to see a small uptick in cases already. She said it's not going to look the same as it did in March and April.
Where we're seeing the spread occur now is in private spaces, where we feel comfortable, where we take off our mask and we invite in our neighbors and friends. And that's what's resulting in now community spread. And so really understanding where that's happening, stopping it before it becomes broad-based, and really proactively giving messages to communities about how to safely gather, how to be socially engaged but physically distant.
Dr. Birx said workplaces, restaurants, and stores won't be the main concern because measures have already been put in place in those areas, and they're working in keeping people safe there. She also stressed the importance of wearing a mask. I'm Kate Walsh, 12 News.